Hi, good afternoon. My name is Missy Joseph, and today my presentation is about the Affordable Care Act, Smoking Cessation and Prevention. Um, the reason why I choose this subject is because in the last 6 months, I've had like 4 different patients diagnosed with lung cancer, throat cancer, mouth cancer. And so it seems like it's a conversation that I'm having almost on a regular basis. Um, and I also choose that because I have a family that I know who are generational smokers, which means the grandmother, mother, and the children, they smoke. So I just feel like maybe this presentation can be a presentation for a population like that. So what do I know about the mandated smoking cessation and prevention? Well, in 2010, when they mandated prevention services, tobacco was one of the part that was included. Why the government is choosing to do that now? Well, because smoking is the number one leading cause of death in the United States. To some, it might be a shocker because they might be like, well, it's not a disease. Well, it's not a disease, but it does link to so many diseases. I mean, I can name so many. To give a few: diabetes, high blood pressure, high blood pressure, heart disease. Let's not forget cancer, kidney problem, and so on and so forth. So the government feel like they need to do something to really stop this trend and bring it back a little bit so we can have a healthier nation. So so the smoking cessation and prevention services really basically says you can have these services available without you sharing the cost with your insurance company, whether it's Medicaid, Medicare, private insurance, or what so on. But your coverage depending on your benefit depending on the type of insurance you have. So, for instance, for Medicaid, age 65 and older, or some of the disabled people, they do have like medication available like nasal spray, nicotine nasal spray, inhaler, patch gums, I would think. Wellbutrin is one of the prescription medication, and sometimes Part D may cover some of the other medications. They have counseling session up to 4 years. They have a prevention service with the provider, and they, if they choose to quit, if they quit one time, they can go back the same year and get another attempt, which I think is cool. People to know that you have support. If you quit, it's not the end of the day. We still got you. So I like that. But then we're going to talk about traditional Medicaid, which is for the low-income people and the disabled. So that one, they divided into pregnant and non-pregnant. So for the pregnant women, they have access to all FDA-approved medication, smoking cessation medication, and also they have group fund and individual counseling to help them. And for the Medicaid, the general Medicaid population, they only cover the medications, all FDA-approved medications for them. So, which is still a lot to me. But there's also 3 group of insurance group. That's the we're talking about the extended Medicaid. We also talk about the group employer group insurance, and also the state insurance market plan, which is for those are the people who purchase the insurance through healthcare.gov. For the extended Medicare, it's for the people who meet like an income level poverty percentage federal of 138% and or higher. And for the group insurance, employee group insurance for people who purchase the insurance through their job. So with these 3 groups, they basically cover the same thing. It's 4 sessions of individuals group of fund counseling, 90 days of all FDA approved smoking cessation medication, and if they quit, they can go back one more time to help them, get back into the program, and they don't need a prior authorization, which to me is a great thing because when you need a prior authorization, you have time to think, and you really don't want to go through it because sometimes it takes so long and you have to go through so many people. So you really get discouraged. So for them not to need a prior authorization is a great thing. So I want to talk about the American Lung Association. which is the group really that really they're, it is the group that manages, at least try to manage providing education related to your lungs, like so smoking is a big thing with them. So they there to provide support and education researches, and they doing everything that they can to work with the government to provide these services to people. So I hope I didn't bore you out. Thank you so much for taking the time and listening to my presentation. I will see you soon. Thank you.